Okay, here's a serious one. Not much joking around on this subject. I want to talk to you about abuse. As I said, most elderly abuse occurs in the home residential setting, but there can be occasions where nursing homes experience it as well. The typical abuse I would substantiate in a nursing home would be this kind of scenario. A resident unexpectedly hits or curses a staff member, and a staff member responds in kind, doing the same thing. That would be substantiated as abuse. So that would be what I'd run into. And it's usually like a one-time thing, and it's just all of a sudden somebody reacts, curses them back very violently or aggressively, or slaps them back in their face or on their head or something. That would be considered abuse. And what happens with something like that is not only are they terminated, they go on like a blacklist of, which indicates that anytime somebody is hired at a nursing home, they have to check this list. If this person is on the list, you can't hire them. And that could go for 2 years, it could go for indefinitely. It just depends on the seriousness of the abuse. Now, sometimes I get allegations from like employees about somebody else being rough or abusive. And I go in, and the resident has dementia, cannot recall anything happening. There's no physical evidence of any abuse. The alleged perpetrator denies any action, anything being done that was inappropriate, which has always been the case. I don't think I've ever had anybody admit it. And the witness sticks by their story. They seem credible, but there's no other employee or resident or anyone saying anything negative about this other employee who's the alleged perp. There's not much I can do about it. I can concern it to the administrator, and sometimes the administrators will get rid of them anyway if I feel like maybe there's some real truth to it. That's really up to the administrator at that point. But, in every case I've ever been, when this kind of scenario has happened, family are like, that person's never going to work. If they keep them, that person's never going to work with my, family member again, right? And the facility's like, yeah, right, that's what we're going to do. So if that scenario that I'm just described happens to your loved one, it's a kind of a he said, she said, and nobody can really substantiate it for sure. You want to make sure that alleged perp or that employee never works with your loved one again. And that's just understood, that should be understood. And when you go visit, everybody knows that. It's no question about it, just the way it is. Might be right, might be wrong, whatever. That's not going to be allowed. Now, hold on. I got a guy getting ready to pass me. I don't want to be blabbing here. Okay, here we go. Yeah, the guy that just passed me said it gets a little more maybe icy and stuff up ahead, so I'm going to have to keep my eyes peeled. So, yeah, I was saying the other people that, maybe they're going to make an allegation of abuse, or, sometimes that's the resident themselves. Now, if it's your loved one, sometimes with people, they can, they say stuff that doesn't happen. It could be just confusion. It could be being manipulative. Your loved one, if they do that kind of stuff or not, generally, right? And sometimes you may not know because it's a new pattern. They get confused, and all of a sudden they start doing this and that. But if it's not substantiated, kind of the same thing applies, unless it's very clear. And sometimes it's very clear. It's like, no question at all that it didn't happen, because it's just so crazy, the allegations being made, So you kind of know that. If that's the case, you kind of know. But if you don't know, you can always ask the facility, hey, I don't want this person working. If they keep them, you can know, I don't want this person working with my loved one. You're well within your rights to request that. The other times is, there might be some altercation between your loved one and another resident, right? And, typically, that's maybe just, two confused folks, and they're frail and weak, and they just, two ladies will be at the dining room and they might slap each other's arms, and that's where it ends and nothing happens. And, they sit them at different tables from here on, and it's not a huge deal. But there are occasions where it might get more serious. It might be somebody that's really confused and strong and might do something violent, and you want to make sure that nothing like that is happening, especially if your loved one is on, like a locked dementia ward, where sometimes people with a lot of confusion, they're still strong. Maybe they can walk around. You want to make sure that you go in, and again, like I said, it always helps to have the DPOA for healthcare, so you can look at the notes, see what's going on. Is somebody confusing your loved one as a spouse? Is somebody kind of having conflicts, raising a cane at them, doing something? Look through those notes and see, is there anything like that going on? Is there any dynamic like that going on? Just to make sure that they haven't been telling you about something that you should know. And if that is the case, if you do find things that are concerning, what is the plan to protect them? And okay, do staff know that plan? You can go in and ask, hey, I worked out some of the DON a couple weeks ago, and I come in here and nobody knows, or nobody's doing it, So those are things I do to keep them safe from other residents that might be problematic. That's pretty rare. I don't want to scare people, but it's a possibility. So it's one more thing just to check out and be aware of, and protect your loved one. It's really hard to tell signs of abuse with sometimes older folks. If they're on blood thinners, they're going to tend to bruise a lot, and if they move themselves around and knock their arms and stuff, they'll get bruises there. I think some things that are real telltale, if we got our little 5 fingers, right? If you're seeing like on forearms or other areas where people are going to be grabbing or moving, if you see those 4 dots and then the opposing thumb mark, that could be something that could be concerning. Somebody's maybe being too rough, grabbing your loved one too hard or too aggressively. You want to bring that to anyone's attention if you're seeing those sort of things. Or if you're just seeing marks in odd areas. Like sometimes staff, they're supposed to use a gait belt on people and move them. Sometimes they'll hook them too hard, like under the armpits, and just lift them. If you're seeing any kind of redness or marks under the armpits, you probably need to let people know, or let the DON know, hey, I'm noticing this. Are they doing the transfer properly? That's another sign. And it's hard to read. Like you say, you kind of know the personality of your loved one. If they're an anxious person by nature, that's one thing. But if they're a mellow person and all of a sudden become anxious and skittish around people, you might want to look into that further. What is that going on? I mean, it could be a lot of things. It could be medication. It could be environment. And it's really hard to tell. I think the best tool, the best tool, and I wish everybody did it, was just to get a surveillance camera. Facilities generally will allow them, not all necessarily, but get a surveillance camera in that bedroom. Get it tied into your phone or into your whatever you've got set up so that you can view back the last week or whatever and just play it forward. That way you really know, because people that are going to do any kind of mistreatment, they're not going to do it out in the open. They're going to do it behind closed doors, right? Or, so you got it. You see what's there, okay? You're going to know it. That's plain and simple. And, it doesn't have to be hidden, because it's probably better that everybody knows, the staff knows, they know they have to be on their best behavior. And that includes, losing personal items as well. That'll lower that happening. But I think that's the best technique I would use, is just getting that surveillance camera in there and having it tied into my cell phone in some ways that I can just review it whenever I want. that's clear cut. Nobody's going to question it. And as a surveyor, it's just substantiated. That's golden. That's golden, because like I said, a lot of times you just don't have anybody. The residents, they can't say anything, and there's no marks necessarily, but somebody could be doing aggressive, mean stuff, and you want to know. Oh, I kind of missed this whole part I didn't mention, but just so when anybody ever alleges abuse, employee, the resident, the witness, anybody, there's certain things the facility has to do, and you can kind of double check on these things, but they have to report it to the state, right? That has to be done rather quickly, usually within 2 hours of becoming aware of that allegation. They've got to start their own investigation, which means they have to start interviewing people like other residents and staff. They have to suspend that alleged perpetrator unless it's clear as clear can be that there's no possible way that this allegation could have occurred. And that is a possibility at times. And the state will come in, and they will usually contact, when they're finished with their investigation, they'll usually contact the next of kin and let them know about the findings or the results. And the facility should also do the same when they're finished with their investigation. Usually has to be within like 5 days at least. All right, well, I'm starting to run into snow already. Hopefully you found that helpful. Gave you some ideas to protect your loved one, especially that surveillance camera. If you can get that, try to get that. And I will see you, not quite yet. Hey, if you liked this and found it helpful, go ahead and give it a thumbs up and share it with friends. And check out a little bit more information at www.nursinghomerisk.com. That's nursinghomerisk.com. Thanks.